monograph for paroxetine, Paxil, suitable for educational, nursing, or clinical reference. NASH paroxetine, Paxil, full drug monograph. Style 1, generic name, drug class, drug forms, brand name. Generic paroxetine, drug class, selective serotonin reuptake inhibitor, SSRI, antidepressant. Drug forms, immediate release, IR tablets, 10 milligrams, 20 milligrams, 30 milligrams, 40 milligrams, controlled release, CR, tablets, 12 milligrams, 25 milligrams, 37.5 milligrams. Oral suspension, 10 milligrams per 5 milliliters. Capsules, Bristol, 7.5 milligrams. Brand names, Paxil, Paxil CR, Pexiva, Bristol. Paroxetine is a prescription antidepressant that belongs to the SSRI class. It is primarily used to treat mood and anxiety disorders by restoring the balance of serotonin in the brain. It is considered effective for a wide range of psychiatric conditions and is also used off-label for other disorders. 3. Mechanism of action. Paroxetine works by selectively inhibiting the reuptake of serotonin, 5-HT, in the presynaptic neurons of the central nervous system. This results in increased synaptic concentration of serotonin, enhanced serotonergic neurotransmission, improved mood, anxiety regulation, and behavior. Unlike tricyclic antidepressants, paroxetine does not significantly affect norepinephrine or dopamine reuptake at therapeutic doses. 4. Indications, uses. Paroxetine is FDA approved for major depressive disorder, MDD, generalized anxiety disorder, GAD, panic disorder, PD, obsessive compulsive disorder, post-traumatic stress disorder, PTSD, social anxiety disorder, SAT, premenstrual dysphoric disorder, PMDD, vasomotor symptoms of menopause, Bristol only, off-label uses, premature ejaculation, diabetic neuropathy, chronic headache, or migraine prevention. 5. Contraindications, hypersensitivity to paroxetine or any component, concurrent use of MAOIs or within 14 days of stopping MAOIs. Use with pimozide or thioridazine, QT prolongation risk. Pregnancy category D, avoid Bristol during pregnancy, can cause fetal harm. Severe hepatic or renal impairment, caution advised. 6. Before taking this medicine, precautions. Inform your healthcare provider if you have bipolar disorder, risk of manic switch, seizure disorders, suicidal thoughts or past attempts, bleeding disorders or use of blood thinners, heart conditions, arrhythmia, QT prolongation, liver or kidney disease, narrow angle glaucoma, electrolyte imbalance. Important precautions. Monitor for suicidal thoughts, especially in adolescents and young adults. Avoid alcohol, may worsen drowsiness and psychomotor impairment. Inform all healthcare providers of paroxetine use, especially before surgery. 7. How to use. Take once daily, preferably in the morning with or without food. Use extended release, CR, tablets whole, do not chew, crush, or break. Use a measuring spoon syringe for oral suspension. Consistency is key, take at the same time each day. Do not stop suddenly, taper under medical supervision. 8. Dosing information. Indication, starting dose, usual maintenance dose, MDD 20 milligrams per day, IR 20 to 50 milligrams per day, 50 milligrams. GAD 20 milligram per day, IR 20 to 50 milligram per day, 50 milligrams. OCD 20 milligram per day, IR 40 to 60 milligrams per day, 60 milligrams. Panic disorder 10 milligram per day, 40 milligram per day, 60 milligrams. PTSD 20 milligrams per day, 20 50 milligram per day, 50 milligrams. SATI 20 milligram per day, 20 to 50 milligram per day, 60 milligrams. PMDD 12.5 milligram per day, 12.25 a day, 25 milligram. Vasomotor symptoms 7.5 milligram Bristol, fixed dose 7.5 milligrams. Elderly and renal hepatic impairment. Start at lower doses due to slower drug clearance. 9. Misdose, overdose. Misdose, take as soon as you remember. If it's near your next dose, skip the missed one. Overdose symptoms, nausea, vomiting, tremor, agitation, confusion, hallucinations, seizures, irregular heartbeat, coma or serotonin syndrome in severe cases. Emergency treatment is required for suspected overdose. No specific antidote. Stop 10. When to stop or avoid taking. Stop taking paroxetine and seek help if you develop signs of serotonin syndrome, fever, confusion, tremors, sweating, muscle stiffness, severe allergic reaction occurs, rash, swelling, difficulty breathing. You experience worsening depression or suicidal ideation. Preparing for MAOI treatment, wait at least 14 days after stopping paroxetine. 11 side effects in detail. Common side effects, cut 10%. Nausea, vomiting, drowsiness or fatigue, dizziness or lightheadedness, dry mouth, insomnia, increased sweating, constipation, sexual dysfunction, decreased libido, anorgasmia, erectile dysfunction, appetite, weight changes. Less common but serious, suicidal thoughts or behavior, seizures, hyponatremia, especially in elderly, serotonin syndrome, abnormal bleeding when used with NSAIDs, aspirin, warfarin, QT prolongation, rare, mostly with thyroidazine pemazide. Withdrawal symptoms if stopped abruptly, dizziness, headache, irritability, insomnia, electric shock sensations, flu-like symptoms. Vital information takes 2 to 4 weeks to notice symptom improvement. Do not stop suddenly, taper gradually. Monitor mood, especially in early treatment or during dose changes. Avoid alcohol and operating heavy machinery. Regular follow-up with a healthcare provider is important. Can cause false positive drug tests for benzodiazepines. Hashtag 13. Other drugs that will affect paroxetine. Drugs that increase risk of serotonin syndrome. Other SSRIs or SNRIs, e.g. fluoxetine, venlafaxine, MAOIs, e.g. phenelzine, isocarboxazid. Triptans, e.g. sumatriptan, tramadol, fentanyl, methadone, lithium, St. John's wort. Drugs that increase bleeding risk. NSAIDs, ibuprofen, aspirin, antiplatelets, clopidogrel, anticoagulants, warfarin, apixaban. Drugs affected by CYP2D6 inhibition. Paroxetine is a strong inhibitor. Tamoxifen, reduced effectiveness. Codeine, reduced analgesia. Metoprolol, dizipramine, risperidone, increased levels toxicity. Others, thioridazine and pimazide, QT prolongation contraindicated. Alcohol, increased CNS depression, diuretics, increased risk of hyponatremia. Summary. Paroxetine. Class, SSRI antidepressant. Used depression, anxiety, PTSD, OCD, PMDD. Inhibits serotonin reuptake. Dosing individualized by condition. Warnings. Suicide risk, serotonin syndrome withdrawal. Interactions. MAOIs, NSAIDs, triptans, tamoxifen. Side effects, nausea, sexual dysfunction, drowsiness. Thank you. Have a nice day.